Good morning, Unadal. I am Dr. P. Sairam, Principal, Sri Sairam Homeopathy Medical College and Research Center, Chennai. So, in this occasion, first of all, I am very much thankful to God Almighty and Chairman Sir Leo Muthu and my dear parents. So, in this great occasion, now I want to explain about the Pathology Department of our college, because you already know about the difficulties faced by the students to handle the pathology. But our pathology professor, Dr. Lalita Pankaj ma'am, MD Homeopathy, and also she had 15 years experience teaching. And after thoroughly he go through the syllabus and everything, now she made it easy to learn about the pathology, because you already know about that one. Visualization is very important. So in this situation, Madam just formed a pathology museum, because you already see these things. Because after completion of the physiology, the students are facing very difficult to understand about the pathology. We already know about that one. Okay, so you already know the pathology, special pathology is there, then bacteriology is there, virology is there, and mycology is there. So Madam just explained these things in a nice manner with the help of our dear students in this occasion. So definitely when you see this video from the first to last, you definitely get an impression and give your valuable opinion regarding that one. Okay, so in this occasion I am also very much thankful to our management, Chairman Sai Prakash Leo Muthu, and our CBO Sir Sadish Kumar, and our pathology professor Dr. Lalita Pankaj madam, and my dear students for this occasion. Thank you very much.
Hello everyone, I am Dr. Lalita Pankajam, HOD Department of Pathology and Microbiology in Sairam Homeopathy Medical College and Research Center. In my 15 years of experience, I came to know some of our students complaining pathology is the very toughest subject to understand what they are studied in the pathology and microbiology and parasitology. So this year I created very easiest way to understand the syllabus of pathology, microbiology and parasitology. I gave idea to the students. So our students make a garden view and displayed each and every topics in the tree view and climbings and pond and kitchen garden, like they are explained everything. I welcome you all to visit the garden and what they are doing in this video. Thank you.
general pathology team have created an apple tree and apple basket representing each chapters in general pathology. Let's explore and acquire more knowledge regarding the same that are perfectly positioned in the following chapters. Now my friend Anis Fatima gonna explain about the first two chapters in the same.
Hello everyone, I am Anish Fatima of 2nd BHMS here to explain the concepts that are given in 1st and 2nd chapter. Chapter 1, History and Evaluation of Modern Pathology, and Chapter 2, Molecular Cell Biology in Health and in Aging. Chapter 1, History and Evaluation of Modern Pathology. History, evaluation and current status of fascinating and colorful specialty of pathology in this chapter under the following main headings. Introduction of common terms and definitions, history and evaluation of pathology, subdivision of pathology, modern method in learning and practice of pathology. Pathology is derived from two Greek words, pathos and logos. Pathos means suffering and logos means study. Pathology is a scientific study of changes in the structure and functions of the body in disease. Some common terms are used such as lesions, etiology, pathogenesis, signs, symptoms, diagnosis and prognosis. Chapter 2, Molecular Cell Biology in the Health and in Aging. The cells are the basic unit of tissue which forms organs and systems in the human body. Traditionally, the cells are divided into two main types, epithelial cells and mesenchymal cells. In 1859, Vibrio first published Cellular Theory of Disease. The concepts are under the following major headings: human genome, biomembrane molecular organization and function, biology of cell organelles, extracellular matrix and cellular communication, cell cycle and its regulators, stem cells and regenerative medicine, biology of aging. Thank you. Now my friend Gayatri will take over.
Hello everyone, I Gayatri AU of 2nd BHMS here to explain about the concepts given in chapter 3, 4 and 5. Cellular adaptations and cell injury, inflammation and repair, immunopathology including amyloidosis, cellular adaptation and cell injury. In this chapter we can see the following headings such as responses to cell injury, cellular adaptations like atrophy, hypertrophy, hyperplasia, metaplasia and dysplasia, morphology of reversible and irreversible cell injury including necrosis, gangrene and pathologic calcification, programmed cell death or apoptosis, intracellular accumulation of lipids, protein and pigment, etc. Inflammation and repair. Under the topic of inflammation and repair, we can see the following headings. General features of inflammation, acute inflammatory response, chemical mediators of inflammation, acute and chronic inflammation, common examples of granulomatous inflammation such as tuberculosis, syphilis, leprosy, etc. Tissue repair and selected examples of tissue repair. Now chapter 5, immunopathology and amyloidosis. In this chapter we can see about the normal immune system, histocompatibility complex and transplantation, immunodeficiency diseases like severe combined immunodeficiency or SCID, ataxia telangiectasia, AT, acquired immunodeficiency syndrome or AIDS, etc. Hypersensitivity reactions, autoimmune diseases like myasthenia gravis, pernicious anemia, Good-Pasteur syndrome, etc. At last we can see about amyloidosis. Thank you. Now my friend Jai Gayatri will explain about the remaining chapters.
Hello everyone, I am Jai Gayatri of 2nd BHMS here to explain the concepts that are given in the chapter 6, 7 and 8. Chapter 6, Derangement of Homeostasis and Hemodynamics. Chapter 7, Neoplasia. Chapter 8, Infectious Disease. Chapter 6, Derangement of Homeostasis and Hemodynamics. The topics covered under this chapter are homeostasis, derangement of water bodies such as edema, effusion, overhydration and dehydration, disturbance of the electrolytes such as hypo and hypernatremia, hypo and hypercalcemia, hypo and hypermagnesemia. pH of the blood includes acidosis and alkalosis. Chapter 7. The topics covered under this chapter are definition and types, characteristics of the tumor, epidemiology of the cancer, molecular basis of the cancer, carcinogenesis and carcinogen, clinical aspect of the neoplasia. Chapter 8, Infectious Disease. The topics covered under this chapter are general consideration, bacterial disease such as plague, anthrax, pertussis, staphylococcus, pneumococcus infection, etc. Viral infections such as viral hemorrhagic fever, influenza virus infection, varicella zoster infection, etc. Fungal disease such as candidiasis, mycetoma, etc. Parasitic disease such as amoebiasis, malaria, filariasis, etc. Torch complex and microbial bioterrorism. Thank you. Now my friend Padmashri will take over.
Hi everyone, I'm R. Padmashri of 2nd year BHMS, here to explain you about the concepts in chapter 9, 10 and 11. Chapter 9, Environmental and Nutritional Diseases. This chapter deals with disease conditions under the following heading. Environmental diseases. First point is environmental pollutions like air pollution, tobacco smoking, etc. Second one is chemical and drug injuries. Third one is injury by physical agents like thermal injury and electrical injury. Under nutritional diseases, we have obesity and its effect, starvation, protein energy malnutritions like kwashiorkor and marasmus, deficiencies of vitamins, and also diet and cancer. Chapter 10, Genetic and Pediatric Diseases. Under genetic diseases, we have developmental defects like intrauterine fetal death and intrauterine growth retardations, etc. Second one is karyotypic abnormalities, which includes numerical abnormalities and structural abnormalities. Third one is Mendelian disorders like mutations, protein disorders, and storage disorders. Under pediatric diseases, we have non-neoplastic conditions like fetal hydropsy and sudden infant death syndromes. Second one is tumors of infancy and childhood, which includes hemangioma, liver cell adenoma, etc. We have also made this climber representing the contents of hematopoietic system and lymphoreticular system. Chapter 11, An Introduction to Hematopoietic System and Disorders of Erythroid Series. In this chapter, we have bone marrow and hematopoiesis, erythropoiesis, anemias, general considerations, hypochromic anemias, megaloblastic anemias, hemolytic anemias, and also ablastic. Thank you everyone. Now my friend Rohini will take over.
Hello everyone, I am Rohini Roslin R of 2nd BHMS, here to explain the concepts that are given in 12th, 13th and 14th chapter. Chapter 12, Hemostatic System, Bleeding Disorders and Transfusion Biology. In this chapter, there are three headings. Hemostatic function, that includes thrombopoiesis, mechanism of hemostasis, and test for hemostatic function. Bleeding disorders such as vascular bleeding disorders, bleeding due to platelet disorders, bleeding due to coagulation disorders, and disseminated intravascular coagulation. Transfusion biology, that includes ABO, transfusion process. Chapter 13, White blood cells proliferations and myeloid neoplasm. Following conditions of leukocyte series have been white blood cells, normal and reactive proliferations, that include leukopoiesis, mature leukocytes in health, and pathological variations. Lymphoid malignancies and its classification, etiology, and pathogenesis. Myeloid neoplasm such as myeloproliferation neoplasm, acute myeloid leukemia, and myeloplastic syndrome. Chapter 14, Diseases and Lymphoid cells of blood and lymphoreticular organs. Non-neoplastic diseases of lymphoreticular organs such as normal and reactive lymphadenitis, common lesions of the spleen like splenomegaly, etc., and common diseases of the thymus like thymomas, etc. Lymphoid and histiocytic neoplasms, that includes precursor lymphoid neoplasms, mature B cells neoplasms, mature T cell and NK cell neoplasm, plasma cell disorder, histiocytic and dendritic cell neoplasms. Thank you.
Everyone, we systemic pathology team have created a mango tree, and we separately prepare small booklets representing each systemic pathology chapters and its contents.
Let's explore and gain some information regarding the same. Now my friend Muthu Selvi is going to start the topic.
Hi, I am Muthu Selvi from 2nd BHMS. Now I am going to explain about following three chapters: blood vessels and lymphatics, the heart, the respiratory system. Now I am going to explain about the blood vessels and lymphatics. Major disease of the blood vessels include degeneration ulcerations, inflammation, and certain tumors. It includes arteriosclerosis, vasculitis, aneurysm, common non-neoplastic disease of veins,
common non-neoplastic disease of lymphatics and tumors.
Now I am going to explain about the chapter heart. Heart diseases are described here on the basis of anatomic lesion involved and functional impairment produced under the following headings: congenital heart disease, ischemic heart disease, heart failure, rheumatic heart disease and rheumatic fever, non-rheumatic endocarditis,
alveolar disease and deformities and tumors of the heart.
Now I am going to explain about the respiratory system. Disease of the respiratory system are described as congenital anomalies, respiratory distress syndrome, pulmonary vascular disease, and pulmonary infections are lung abscess, pneumonia, and pulmonary tuberculosis. And chronic obstructive pulmonary disease (COPD) are chronic bronchitis, emphysema, bronchial asthma, bronchiectasis, and small airway disease. Next, chronic obstructive lung disease and tumors of the lung and disease of the pleura.
Thank you. Now my friend Mollifa will continue.
Thank you, Muthuselvi. Hi, I'm Oliver from 2nd BHMS. Now I'm going to explain about the topic ENT, then musculoskeletal system, male reproductive system, eye, ear, nose and paranasal sinus, larynx, pharynx and the neck. The inflammatory conditions of eye are sty, chalazion, endophthalmitis, panophthalmitis, keratitis, conjunctivitis, keratoconjunctivitis, sympathetic uveitis and granulomatous uveitis. So vascular lesions are hypertensive retinopathy, diabetic retinopathy and retinal infarcts. In miscellaneous condition they have sebaceous carcinoma, retinal blastoma. Conditions of ear will have otitis media, acute rhinitis, allergic rhinitis, sinusitis and nasal polyps. So inflammatory conditions of pharynx are Ludwig's angina, Vincent angina, diphtheria, tonsillitis and peritonsillar abscess. Inflammatory conditions in larynx are acute laryngitis, chronic laryngitis, tuberculous laryngitis, acute edema of the larynx. In neck will have a cyst of neck. There are of two types, medial cervical cyst and lateral cervical cyst. Disease under the male reproductive systems are testis and epididymis. Inflammatory conditions are non-specific epididymitis and orchitis, granulomatous orchitis and tuberculous orchitis. Inflammatory conditions of the penis are phimosis. Inflammatory conditions of prostate, they are of two types, acute prostatitis and chronic prostatitis. Carcinoma of the prostatis are of four types. They are latent carcinoma, incidental carcinoma, occult carcinoma and clinical carcinoma. Musculoskeletal system. So the disease under the musculoskeletal system are necrosis, infiltrations and fracture healing, metabolic and endocrine disorders, tumors, tumor-like lesions and tumors of bones and cartilage. Degenerative joint disease, osteoarthritis and inflammatory joint disease, rheumatic arthritis, myopathies and myasthenia gravis. My friend Lavanya is going to explain about the next chapter. Thank you.
Thank you, Molifa. This is Lavanya from 2nd BHMS. I am going to explain about 3 chapters: gastrointestinal tract, kidney and urinary tract, liver, biliary tract and exogyne pancreas. Gastrointestinal tract. The important inflammatory diseases are esophagitis, gastritis, peptic ulcer, peritonitis, colitis, inflammatory bowel diseases. The important diseases of these chapters are Crohn's disease, hematemesis, hemorrhoids and colorectal polyps. The next chapter we will see about liver, biliary tract and exogyne pancreas. The important diseases are liver cell necrosis, jaundice, liver hepatic, liver abscess, alcoholic cirrhosis, biliary cirrhosis, cystitis, cystocholecystitis and tumors, pancreatitis. The final chapter is the kidney and lower urinary tract. The important diseases are renal failure, renal cortical disease, urethritis, renal vascular diseases, tubular and tubulorectal diseases, tubular and tubular intestinal diseases. Next chapters will be carried on by my friend Dhanlashmi. Thank you.
Hello everyone, I am Dhanlashmi Ara, 2nd BHMS, here to explain about the female genital tract, the skin and the endocrine system. Now chapter 24, the female genital tract. The diseases that affect the female genital tract are as follows: in vulva and vagina, vaginitis, vulvovaginitis and tumors; in cervix, cervicitis and tumors; in body uterus, endometriosis, adenomyosis and tumors; in fallopian tube, salpingitis and tumors; in ovaries, polycystic ovarian disease and ovarian tumors; in placenta, hydatidiform mole and tumors. Now chapter 26, the skin, dermatopathology. Let's see about it under the following topics: normal structure, dermatosis that includes dermatitis or eczema, urticaria, lupus erythematosus, psoriasis, etc. Tumor and tumor-like lesions that include epidermal, adnexal, melanocytic, dermal, and cellular migrant tumors. Now chapter 27, the endocrine system. Endocrine diseases occur due to three conditions such as hormonal deficiency, hormonal excess, and hormonal resistance. The endocrine diseases that affect the endocrine glands functionally are as follows. In pituitary gland, hyperpituitarism, hypopituitarism, and tumors. In adrenal gland, adrenocortical hyperfunction, adrenocortical insufficiency, and tumors, etc. In thyroid gland, thyroiditis, hyperthyroidism, hypothyroidism, goiter, Graves' disease, and tumors, etc. In parathyroid gland, hyperparathyroidism, hypoparathyroidism, and tumors, etc. In pancreas, diabetes mellitus, islet cell tumors, and some more multiple endocrine disorders. Thank you. Now my friend Pooja will take.
Dhanalakshmi, I am Pooja from 2nd BHMS and I will explain 4th chapter. Those are oral cavity and salivary gland, breast, soft tissue tumor, nervous system. The diseases are discussed in the chapter under the following headings. Oral cavity and salivary gland, stomatitis, glossitis, tuberculous, dental caries, odontogenic cyst, siluria, oncocytoma. Breast, mastitis, acute and chronic mastitis, fibrocystic lesion, breast abscess, mammary duct ectasia, in situ carcinoma, invasive breast carcinoma, gynecomastia, soft tissue tumor, lipoma, liposarcoma, fibromas, fibrosarcoma, fibromatosis, nodular fasciitis. Nervous system, hydrocephalus, encephalitis, meningitis, meningiomas, Parkinson disease, peripheral neuropathy, neurofibromas, and von Recklinghausen disease. Thank you.
Microbiology team has created 10 different plants and creepers which representing each chapter. So let's explore and know about its content.
So myself Priyanka, I am going to talk about identification of bacteria and morphology and physiology of bacteria.
Identification of bacteria and morphology and physiology of bacteria.
So let's see about identification of bacteria. Identification of bacteria totally depends upon its morphology, microscopy, staining reactions and cultural characteristics. Morphology depends on its strain, nature of culture and its medium, temperature, time of incubation, age, culture and number of subcultures. Microscopy depends on its shape, size, arrangement, motility, flagella, spores and capsules. In staining reactions, gram stain is used to differentiate gram positive and gram negative. Z-Nielsen stain is used to differentiate acid fast and non-acid fast. Now let's see about the morphology and physiology of bacteria. Microorganisms are usually heterogeneous. Based on differences in cellular organization and biochemistry, they are divided into prokaryotes and eukaryotes. Microscopies used to determine their shape and size are optical or light microscope, fluorescent microscope, dark field or dark ground microscope. Depending upon their shape, bacteria are classified into several types. They are cocci, bacilli, vibrios, spirella, spirochetes and mycoplasma. Thank you.
Now my friend Pooja will take over.
Thank you, Priyanka. Hello everyone, myself Pooja. I am from 2nd BHMS. I am going to explain about immunity.
Immunity.
and antigen and antibody reaction.
The term immunity refers to the resistance exhibited by the host towards the injury-causing microorganism and their products. It is broadly classified into two types, innate and acquired. Innate immunity is again divided into specific and non-specific, and each of which is again divided into species, racial, and individual subdivisions. Acquired immunity is again divided into active and passive immunity, each of which is again divided into natural and artificial immunity. And now we are going to see about antigen and antibody reactions. So we know that antigen and antibody, by the definitions, combine with each other in a specific and observable manner. Its uses is, in our body they form basis antibody mediated immunity and infection disease, and in laboratory they help in diagnosis of infection. There are three stages: primary, secondary, and tertiary. Primary stage, it is the initial interaction between the antigen and antibody without any visible effect. The primary stage is followed by secondary in the most of the reactions. It has demonstrable events such as precipitation, agglutination, lysis of cells, neutralization, toxins, and immobilization of motile organisms. Tertiary stage, antigen and antibody reactions may cause chain reactions in the living organism, which causes neutralization or destruction of injurious agents. Thank you.
Now my friend Yuvashri will take over.
Thank you, Pujashan.
I'm Yuvashri from 2nd BHMS. I'm going to explain about culture methods.
Culture methods and infections.
The methods employed to isolate the organisms in a laboratory. These methods are streak, lawn, stroke, jab, and pour plate on solid media. Inoculation methods on solid media are first one, loops or straight wires. It is used to transfer material onto culture plates. The lawn or carpet culture useful for antibiotic sensitivity testing. Stab cultures for demonstration of oxygen requirements of the bacterium under study. Pour plate culture method done for quantitative urine cultures, and liquid cultures. Bottles or flasks may be inoculated by touching with a charged loop, peptides or syringes. Then I am going to explain about infection. It is interaction between the host cells and the infective microorganisms. It is classified into primary infection, pre-infection, secondary infection, focal infection, cross-infection, nosocomial infection, iatrogenic infection, and endogenous or exogenous infection.
Now, my friend Sindhuja will take over.
Thank you, Yuvashri. Hello everyone, myself Sindhuja from 2nd BHMS. Now we are going to see about sterilization and culture media. Sterilization. It is defined as a process by which an article, surface or medium is freed of all living microorganisms either in the vegetative or spore state. There are two sterilization agents. They are physical and chemical agents. The physical agents are dry heat, moist heat, filtration and radiation. The chemical agents are alcohols, peracetic acid, aldehydes, hydrogen peroxide, hypochlorous acid, dyes, allergens and phenols. In dry heat, flaming, incineration, hot air oven. In moist heat, pasteurization of milk, incipation, boiling, tenderization and autoclave. Filtration. It helps to remove bacteria from meat-level liquids such as serum and sugar solution or antibiotics. Radiation. There are two types of radiation, ionizing radiation and non-ionizing radiation. Culture media. It is used to identify clinically important bacteria. It is done by inoculating the sample and growth media required for the bacteria to replicate and form colonies on solid media or suspensions in liquid media. The commonly used medias are liquid media, solid media, simple media, complex media, synthetic media, enriched media, enrichment media, selective media, indicator media, differential media, and transport media. Thank you everyone. Now I welcome Rehnat to continue the topic.
Thank you, Sindhuja. Hello everyone. Myself is Rehnat from 2nd BHMS. I am going to explain about hypersensitivity reaction and complement system.
Hypersensitivity reaction and complement system.
The term hypersensitivity refers to the undesirable injurious consequences in the sensitized host following contact with specific hypersensitive reactions have been classified into based upon the duration between exposure to antigen and reaction as immediate and delayed, based upon the components involved in the reaction as antibody mediated and cell mediated, based upon gels and Coombs classification as type 1, immediate anaphylactic. Clinical conditions resulting from type 1 are systemic anaphylaxis, allergic extrinsic asthma, and allergic rhinitis. Type 2, cytotoxic. Clinical conditions resulting from type 2 are transfusion reaction, hemolytic disease of newborns. Type 3, immune complex mediated. Clinical conditions resulting from type 3 are hepatitis B virus, persistent infection with streptococcus. Type 4, cell mediated delayed hypersensitivity. Clinical conditions resulting from this are allergic contact dermatitis. disease. Type 5 stimulatory hypersensitivity. It is a modification form of type 2. Complement system. Term complement refers to a system of factors that occurs in normal serum and it is activated characteristically by antigen-antibody interaction and which subsequently mediates a number of biologically significant consequences. Complements can be activated in 3 pathways: classical pathway, which requires specific immune reaction for activation; alternate pathway and lectin pathway are antibody immediate. Thank you.
Hello everyone, we the bacteriology team have created a cobweb representing each chapters in bacteriology. Now let us explore and gain some knowledge about this content. My topic is Streptococcus and Staphylococcus.
Streptococcus and Staphylococcus. Staphylococci are gram-positive cocci that occur in grape-like clusters. Staphylococci are spherical cocci approximately 1 mm in diameter. Staphylococci are among the most resistant non-sporing bacteria. Staphylococcal disease, skin and soft tissue, folliculitis, furuncle, musculoskeletal, osteomyelitis, arthritis, respiratory, tonsillitis, pharyngitis. Central nervous system includes abscesses, meningitis. Toxic shock syndrome, food poisoning, scald skin syndrome. Streptococci are gram-positive cocci arranged in chains and pairs. The disease caused by S. pyogenes can be suppurative or non-suppurative. Of streptococcal disease, respiratory infection includes pharyngitis, tonsillitis. Skin and soft tissue includes erysipelas, impetigo. Necrotizing facilities, toxic shock syndrome, genital infection. Other suppurative infections such as brain, lungs, liver and kidneys.
Thank you. My friend Haripriya will carry over the section.
Thank you, Diagnostic. I am Kirtana from BHMS second year. I am going to explain about Mycobacterium tuberculosis and Neisseria.
Mycobacterium tuberculosis and Neisseria.
Mycobacterium tuberculosis, which causes tuberculosis in man, it mainly affects lungs. It is classified into 2 types. One is primary tuberculosis and secondary tuberculosis. Clinical symptoms: patient having cough with expectoration, weight loss, loss of appetite, night sweats, fever, chest pain, blood-stained sputum. Neisseria, which causes 2 types of disease. One is Neisseria meningitis and other is Neisseria gonorrhoeae. Neisseria meningitis causative organism Neisseria meningococci. This organism is passed through conjunctiva and nostril. When it enters through the conjunctiva, it forms mucopurulent conjunctivitis. When it enters through nostril, it forms colonies in the nasopharynx and it spreads to the bloodstream and it lodges into the subarachnoid space of the meninges, which produces meningococcal lesions. On the time, the patient have asymptomatic and some patients may develop inflammatory conditions like rhinitis and pharyngitis. Neisseria gonorrhoeae, which causative organism is Neisseria gonococci. It is a sexually transmitted disease. During sexual contact, this organism enters through the urethra and other mucosal surfaces. In men, it causes mucopurulent urethritis with discharges, and it may also spread to prostate, seminal vesicles, and epididymis. In women, it affects urethra and cervix. The vagina does not affect it because the vaginal pH is acidic.
Thank you, my friend Haripriya will continue. Thank you, my friend Haripriya will continue.
Thank you, Kirtana. I am Haripriya, second BHMS. I am going to explain about Corynebacterium diphtheria and Salmonella typhi. Corynebacterium diphtheria, it is a gram-positive bacteria, rod-shaped and non-motile. It produces the club-shaped swelling and leathery pseudomembrane. It comprises of babes and granules, which is served as a storage granule, and it resembles the V or L letter called cuneiform or Chinese letter. It produces exotoxin. It is a causative agent of diphtheria. The clinical features are cellulitis, ulceration, bleeding, toxemia, etc. The laboratory findings, the dark-ground sharps has been used. It has been taken from the pseudomembrane, and the stains used is loflastine. Salmonella typhi, it is a gram-negative bacteria which is motile, rod-shaped. It is typhoidal and non-typhoidal. It comprises of antigenic structures, that is H, O and Vi antigen. It is a causative agent of typhoid fever. It produces the septicemia and trick fever and food poisoning. Laboratory findings, vital tests have been done. Thank you. My friend Jasmine will take over this.
Priya, myself HB Janna Jasmine, second year BHMS.
Topic is Vibrio and Pneumococcus.
Vibrios are gram-negative curved bacilli that are actively motile by means of a polar flagellum. They are non-sporic and they are non-capsule. Most important member of the genus is Vibrio Cholerae, causative agents of cholera. Vibrio cholera. The cholera vibrio is short, curved, cylindrical rod. The cell is typically comma-shaped. Cholera is an acute diarrheal disease, the symptoms being profuse, painless, watery diarrhea, which lead to hypovolemic shock and death. The incubation period is 24 hours to 5 days. Pathogenesis occurs in humans, enters orally, and is highly susceptible to acids. Laboratory diagnosis. Stool examination is done in cases of acute stage pneumococcus. They are gram-positive, lanceolate shaped diplococcus. It usually affects the upper respiratory tract. Morphology. Streptococcus pneumoniae are typically slightly elongated cocci with one end broad and other end pointed. They occur in pairs. Streptococcus pneumoniae colonize the human nasopharynx and may cause infection of the middle ear, paranasal sinus and respiratory tract. Mainly causes pneumonia. It causes both lobar and bronchopneumonia. Laboratory diagnosis, sputum, CSF, blood, and PCR methods are also used in cases.
Thank you. My friend Ashifa Sharin will continue.
Thank you, Janet Jasmine. I am Ashifa from 2nd BHMS. Now I am going to say about Sigilla and Mycobacterium leprae.
Sigilla and Mycobacterium leprae.
Mycobacterium leprae is a gram-positive and acid-fast bacilli. It causes leprosy. Leprosy affects the skin, nerve, eye and upper respiratory tract. Mode of infection is through skin or respiratory tract. Most of the damage is mainly on spinal nerves. It leads to loss of sensation of touch, pain and temperature. Hence, patients remain asymptomatic. If this starts appear, it produces nodes on the skin. On leprament test, 0.1 ml of leprament is injected to a human being. It waited for 1 to 2 weeks. There is infiltration of lymphocytes and endothelial cells and germ cells. Sigilla are gram-negative rods and short. There are two types of dysentery, amoebic dysentery and bacillary dysentery. Bacillary dysentery is caused by Sigilla. Hence, they produce clinical features like loose, scanty feces passes along with blood and mucus. They also produce abdominal cramps and tenesmus. Lab diagnosis, stool examination and microscopic examination. Thank you.
virological and its content. Let's explore and acquire some knowledge from the concept that are perfectly positioned in the following chapter. Hi, I'm Sat Samir, second year BHMS. We are going to take about virological topic. Introduction. Defining characteristic. Virus do not have cellular organization. They contain only one type of nucleic acid, either DNA or RNA, but never both. They multiply by complex process and do not by binary fusion. Morphological. Size. Viruses are much smaller than bacteria. Viruses are too small to see under the light microscope, can only seen under the electron microscope. Viruses were widely in size, largest among them 300 nm. Smallest viruses are 20 nm. Structure and shape. They are classified into capsid, cubical, helical, complex. Most animal viruses are roughly spherical. Some are irregular. Temperature. Viruses are very heat liable. They are inactivated within second at 56 degrees Celsius, minute at 37 degrees Celsius, days at 4 degrees Celsius. pH. Viruses were greatly resistant to acidity. Radiation. Viruses are inactivated by the sunlight, UV rays and ionization radiation. Thank you. My friend Homeopathy will take place.
Hello everyone. I am Homeopathy of 2nd BHMS. To explain about bacteria and fox virus. Bacteria pages are virus infect bacteria. Pages occur widely in nature in close association with the bacteria. Pages important role in the transmission of genetic information between bacteria by the process of transduction. Carries of genes from one bacterium to another bacterium. These known as transduction. Significance of pages. One page is assay, another one page is typing. Fox virus are the largest virus infect the vertebrate. The classification of the fox virus. One is orthofox virus, parafox virus, caprifox virus, avifax virus. Smallpox caused by the variola virus. Other fox virus disease. One is monkeypox, cowpox, milker node, fox, contagion. These disease characterized by the pearly white wart-like nodules on the skin. Thank you.
Hello everyone, I am RB Pooja Varshini of 2nd year BHMS. I am going to explain about picornavirus. Picornavirus is a family of non-enveloped viruses with a single-strand RNA genome. Enteroviruses and rhinoviruses are important human pathogens. Enteroviruses, they are of three types: polioviruses, coxsackie and echoviruses. Polioviruses, they can be isolated in tissue cultures. Poliomyelitis is caused by 3 polioviruses with type 1 producing severe effects. Only humans are naturally infected. Coxsackie viruses, they are of two types: Coxsackie A viruses, Coxsackie B viruses. Coxsackie A viruses causes upper extremities and lower extremity diseases and meningitis. Coxsackie B viruses infects meningitis, endocarditis and myocarditis. Echoviruses are most commonly seen in feces of healthy children. It causes severe neonatal diseases. Rhinoviruses have a worldwide distributions. It causes common cold.
Thank you, Pooja Varshini. I am Reticular of 2nd BHMS here to explain about adenovirus and HIV virus. Adenoviruses are a group of medium-sized, non-enveloped, double-stranded DNA viruses. Classification: they are classified into masked adenoviruses and aviadenoviruses. Pathogenicity: adenoviruses cause infections of the respiratory tract, eye, bladder and intestine. Pharyngitis, pneumonia, acute respiratory diseases, pharyngoconjunctival fever, epidemic keratoconjunctivitis, acute follicular conjunctivitis and diarrhea. Laboratory diagnosis. Diagnosis can be established by tissue culture, serodiagnosis, electron microscopy, immunofluorescence, PCR-based tests. Human immunodeficiency virus. HIV, the causative agent of AIDS, belongs to the lentivirus subgroup of the family Retroviridae. The natural course of HIV infection passes through the following stages. Group 1, acute HIV infections within 3 to 6 weeks. Group 2, asymptomatic or latent infections. Group 3, persistent generalized lymphadenopathy. Group 4, AIDS-related complex. Laboratory tests are done for diagnosis of clinically suspected cases, monitoring of treatment, screening of blood, antenatal screening of mothers, screening high-risk people. Strategies for HIV testing: ELISA tests, rapid tests, supplemental tests. HIV is spread only by 3 modes: sexual contact with infected people, by blood and blood products, infected mother to the babies. HIV is primarily a sexually transmitted infection. Thank you. Next, Lakshmi Priya will take over.
Hello everyone, this is Lakshmi Priya of 2nd BHMS. Now I am going to tell about Myxovirus. Myxovirus is a group of RNA enveloped virus. Myxo means mucus with one-cell mucin receptor present in the RBC which leads to hemoobliteration. Myxovirus is further classified into 2 types: orthomyxovirus and paramyxovirus. Orthomyxovirus consists of influenza virus. It is spherical, pleomorphic and filamentous form. It is further classified into serotypes A, B and C. Clinical features of influenza virus include: incubation period of influenza virus is 1 to 3 days. Uncomplicated influenza virus consists of Raynaud's syndrome, common cold and upper respiratory tract problem. Complications: of influenza virus includes pneumonia by secondary bacterial infection, other pulmonary diseases like COPD and asthma, Ray's syndrome, which include fatty degeneration of liver and acute encephalopathy. Laboratory diagnosis of influenza virus is isolation of virus, serological test, PCR-based diagnosis. Paramyxovirus, which resembles orthomyxovirus morphologically but are large and more pleomorphic. They are classified into mumps, rubella virus, parainfluenza virus, and measles. Mumps are rubella virus. It is characterized by non-suppurative enlargement of parotid glands. The incubation period of mumps virus is 12 to 25 days. Complications of mumps, epidemic orchids, meningoencephalitis, parainfluenza virus. There are 4 types of parainfluenza virus have been identified. Clinical features. Prodromal stage consists of fever, coryza, and nasal discharge. Eruptive stage consists of papular rash and populi spots. Post-nasal stage consists of diarrhea and weight loss. Complications of measles consist of otitis media and pneumonia. Late complications include SSPE, subacute sclerosing, endocarditis, which is a rare complication. Thank you.
Hello everybody, this is Zubeda. I'm going to speak about rhabdo and miscellaneous viruses. Rhabdoviruses are bullet-shaped enveloped with single-stranded RNA genome that are responsible for causing rabies, also known as hydrophobia. This disease is transmitted by the bite of mad dogs. Miscellaneous viruses, the word miscellaneous denotes various types or from different sources. The miscellaneous viruses are again divided into 8 different types of viruses. First being the papoviruses. The papoviruses are again divided into polyoma and papilloma viruses, which are responsible for causing various types of cancers. The second being the parvoviruses. Parvoviruses are responsible for causing infections like erythema infectiosum and fetal hydrops, etc. The third being slow virus diseases, which are again divided into Group A, Group B and Group C. Group B are responsible for causing prions diseases. Group C causes diseases like subacute sclerosis and encephalitis. The fourth being rubella virus is responsible for causing rubella infection. In pregnancy, rubella infection can lead to congenital malformations of the fetus. The fifth being viral hemorrhagic fevers responsible for Lassa fever and Ebola. The sixth being coronavirus, that is responsible for the pandemic novel coronavirus and COVID-19. Also the epidemic SARS and MERS. The seventh being Neoviridae family, that is again divided into 3 groups: Reovirus and Orbivirus, Rotavirus. The eighth being other viruses that are responsible for causing diarrhea. Example: coronavirus, adenovirus, arbovirus and Norwalk virus. Thank you.
Hello everyone, I am Priyadeshini of 2nd BHMS and I am here to present about the topic oncogenic viruses and hepatitis virus. Oncogenic viruses are those viruses that produce tumors on the natural host. Oncogenic DNA virus are Papovirus, Pox virus, herpes virus, hepatitis virus and adenovirus. Oncogenic RNA viruses are retroviruses. Papovirus causes cervical, cellular and penile cancers. Herpes virus causes nasopharyngeal carcinoma, and it has also association with hepatocellular carcinoma. Hepatitis viruses are those viruses that causes primary infection in the liver, and it also differentiates because of the heterogeneous groups that ranges from A to G. Most of the hepatitis A viruses are asymptomatic, and its transmission occurs through fecal-oral. Type B hepatitis virus is the most common type of infection, and it has the longest incubation period of 1 to 6 months. Type C hepatitis viruses are the persons who are carriers. Hepatitis D virus infection or co-infection that are clinically present as acute infection B. Thank you.
have created the dogs with some notes. I am Prashant of second year BHMS. I will explain about general aspects.
Mycology, general aspects. The word mycology derived from Greek word mycus. It means fungus. Mycology is a branch of microbiology. It deals with the study of fungus. Microbiology were recognized earlier than the bacteria as a causative agent of human diseases. Classification of fungi: yeast-like fungi, molds, dimorphic fungi. Cryptococcus neoformans, for example. Microscopians, oval to round. Next, yeast-like fungi, spherical to oval. Microscopians. Molds, thread-like filamentous. Laboratory diagnosis of the fungal infections made by the microscopic, serological and skin test specimens. Normally, the specimen is collected from the affected site. Sample of blood collected microscopy. The fungal structure can be detected from the clinical specimen by the direct microscopic examination of the material from the lesions. Next, treatment: antifungal agents, polyenes, promedians, azoles and grams.
I am Nandakumar, second BHMS. I am explain about superficial mycosis and subcutaneous mycosis.
Superficial mycosis is a group of infection caused by the fungus live exclusively the layer of skin and appendages. For example, Tinea Reticular, Tinea nigra, Phytra. Like cutaneous infection, most cutaneous infection dermatophytosis caused by the dermatophytes. Tinea Reticular, another chronic case symptomatic diagnosis பண்ணோம்னா the skin of the scratches பார்த்தோம்னா yeast-like cells. Tinea nigra localized infection of the stratum corneum. Particular form producing brownish blackish macular lesion. Third type Phytra. Phytra is most important cause of the hair la varum. The fourth type dermatophytosis. Dermatophytosis is most important cause of the keratinous texture caused by the keratinophilic fungi called dermatophytes. Acute or chronic lab investigation specimen microscopic examination culture. Subcutaneous mycosis. Fungi causing cultures. Subcutaneous mycosis is largely present in the soil and the pathogen plant. The type is mycetoma. Mycetoma are chronic pluripolyp post-traumatic infection of the subcutaneous tissue. Usually present in the food, rarely present in the other part of the causative agents is mycetoma, actinomycetoma, mycosis. The causative pathogens is causative agents believed to exert through small trauma. This disease usually small subcutaneous tissue developed food. Chromomycosis. Distal chromomycosis includes a group of clinical manifestations caused by the dermatitis fungi. Clinical features is lesion consists of cutaneous nodules which resemble florid cauliflower. Next type is chlorotrichosis. Chlorotrichosis, which is chronic infection involving cutaneous, subcutaneous, lymphatic tissues. Pathogens lesion exposed to part of skin, followed minor trauma. Thank you.
Hello everyone. Myself is Bala from second BHMS. I am going to explain about systemic and opportunistic mycosis. Systemic mycosis refers to disseminated or deep fungal infections which are not restricted in superficial areas. Fungi causing systemic mycosis are Histoplasma capsulatum and Blastomyces dermatitis. Histoplasma capsulatum, which causes histoplasmosis. Its clinical features are lymphadenopathy, fever and anemia. Blastomyces dermatitis, which causes blastomycosis. It is a chronic infection which is characterized by formation of suppurative and granulomatous lesions. It is a primary infection which causes lung tuberculosis and histoplasmosis. Opportunistic mycosis. Opportunistic mycosis which occurs in a patient who are immunosuppressed. These are fungi with low virulence. This includes Aspergillus and Penicillium. Aspergillus which causes aspergillosis. Its clinical features are Aspergillus, bronchopulmonary allergy, lymphadenopathy and asthma. Penicillium causes penicillosis. It is a chronic infection which causes disseminated with multiple organ involvement.
everyone, we the parasitology team have created a pond with some notes that represent each parasitology chapters and its contents. Let's learn about it. Now I invite my friend Shantini to take over.
Thank you, Rishika. I'm Shantini from 2nd BHMS. I'm here to explain about the cystotes. So cystotes are the dorsoventrally flat worms. It is segmented and it resembles like a measuring tape. So cystotes has three parts: the head, the neck and the body. The head is also called scolex. The body is also known as the strobila. The strobila is segmented with its prostocloth. And coming to the Taenia species, the humans are the definitive hosts. And coming to the Taenia saginata, the humans are the definitive hosts and the cattle are the intermediate hosts. When the affected beef and consumed by the humans rawly, which is affected by the Cysticercus bovis, the life cycle is completed. And coming to the Taenia solium, humans are the definitive hosts and the pigs are the intermediate hosts. When the pigs are consumed rawly by the humans, which is affected by the Cysticercus cellulase, the life cycle is completed. So the lab diagnosis is CT scan, ultrasonography and X-rays. Thank you. My friend Bhuvaneshwari will continue with trematodes.
Thank you, Shantini. I am Bhuvaneshwari of 2nd BHMS, here to explain trematodes. Trematodes are unsegmented flatworms. It is divided into three types: blood species, intestinal species and tissue species. Blood species, they include Cystoma hematobium, Cystoma mansoni, Cystoma bovis, and intestinal species, small intestinal flukes. Phaseolopsis busci. Phaseolopsis busci are the largest trematodes infecting human life cycles. Definitive host is human and intermediate host is snails of the genus Sigmanita. Its clinical features: the worm can produce ulceration, local inflammation at the site of infection. Light infection can cause asymptomatic, and heavy infection leads to fever, abdominal pain and diarrhea. Liver flukes. Fasciola hepatica, it's particularly common in Australia and Europe. Lung flukes, also known as the oriental lungworm. Clinical features: in early stage, acute manifestation like hepatosplenomegaly, pleural effusion, pneumothorax, cough, eosinophilia may result in migrating of worms. Lab diagnosis by detecting characteristics in sputums or feces. Thank you. Friend Aishwarya will explain about the amoeba.
Thank you, Bhuvaneshwari. Hello everyone, I am Aishwarya of 2nd BHMS. I am here to explain about amoeba. Amoeba, which is a unicellular organism which does not have a specific shape and size. Intestinal species of amoeba known as Entamoeba histolytica produces intestinal and extraintestinal diseases. Amoeba histolytica exists as precis, cysts and trophozoites. They don't have a specific shape and size. The trophozoites stay in the intestinal mucosa of the large intestine and divide by binary fission. The trophozoites, when passed in feces, die on exposure to air. The Entamoeba histolytica has a very simple life cycle. The metacysts are the infective forms. It infect the humans by contaminated food and water. It is mainly of two types: intestinal and extraintestinal. In intestinal, it is divided into non-invasive and invasive. In non-invasive, it produces asymptomatic and symptomatic conditions. In invasive, it produces acute dysentery, fulminant colitis and toxic megacolon. In extraintestinal type, it produces brain abscess, lung abscess, liver abscess. Lab diagnosis. Stool examination is the important lab diagnosis to find amoebic dysentery. Thank you. Now my friend Govardhan will present about Trypanosoma Bruising.
Thank you, Aishwarya. I am Govardhan of 2nd BHMS. I am going to explain about Trypanosoma Bruising, also called sleeping sickness. Trypanosoma Bruising. It causes more than 90% of reported case of sleeping sickness. Organism exists in two forms: Tryphomastigoids and epimastigoids. Tryphomastigoids are seen in vertebrates as well as in insect hosts, but epimastigoids are seen only in insect hosts. It have a complex life cycle. Definitive hosts are humans and other vertebrates. Intermediate hosts are insects. Laboratory diagnosis are demonstration of the parasite, concentration of the blood, serological test and inoculation of the parasite. Next, my friend Adishweta will going to explain about Giardia intestinalis and Plasmodium.
Thanks, Govardhan. I am Adishweta of 2nd BHMS and I am here to present about Plasmodium species and Giardia intestinalis and Plasmodium species. Now let's see about Plasmodium species. Malarial parasites belongs to genus Plasmodium. There are 4 types of species which infects the human. They are Plasmodium ovale, Plasmodium vivax, Plasmodium falciparum and Plasmodium malariae. Plasmodium falciparum also causes pernicious malaria, which is fatal in nature. Life cycle of Plasmodium species are complex life cycle. It requires 2 human as an intermediate host and Anopheles mosquito as an definite host. Patient complains of malaise, headache, nausea and vomiting, etc. It is followed by chills and fever. The laboratory diagnosis of Plasmodium species is peripheral blood smear. Now let's see about Giardia intestinalis. There are 2 forms, trophozoites and cysts. The mature cysts are responsible for the infection. Cycle is a simple life cycle, and the incubation period of the disease is 1 to 3 weeks. Symptoms are diarrhea, nausea and vomiting, abdominal discomfort, etc. Prevention can be done only by avoiding contaminated water and food. Thank you. Now my friend Humaira will take over.
Thank you, Adishweta. Hello, I am Humaira Fatima of 2nd BHMS. I am here to present about Ascaris lumbricoides. Nematodes. Ascaris lumbricoides is the commonest intestinal nematode. It consists of two forms, egg and larvae. The Ascaris is the largest intestinal nematode form. It measures up to 40 cm in length and has tapering ends. The worm lives up to 1 to 2 years. Life cycle. It consists of a simple life cycle. It needs only one host to complete its life cycle. The infective form for humans is the egg containing larvae. Clinical features. When present in large numbers, the Ascaris lumbricoides causes improper digestion and improper absorption of food. Occasionally, it causes fever, urticaria, wheezing and conjunctivitis. Lab diagnosis. It is diagnosed by the help of the characteristics X in the fecal sample. Thank you. Now my friend Rishika will present about Phyleariasis.
Thank you, Humaira. I am B. Rishika of 2nd BHMS here to explain about Phyleariasis. Phyleariasis. Adelphilarial worms lives in lymphatic tissues of humans and subcutaneous. Vibrio Cholerae is most widely distributed in human filarial parasites. It can be found in China, India, Far East and major projects of Africa, South America and Central America. It can exist in 3 forms. One is adult and the number 2 is microfilarial and the number 3 is larval. The adult form is a thread-like and lives in lymphatic tissues of human and can be tightly coiled nodular masses. Life cycle. It is a complex life cycle where humans are the definitive host, while mosquitoes, anopheles are the intermediate host. Vibrio Cholerae causes Filariasis, which is also known as lymphatic filaria. The majority of the persons infected in endemic area are asymptomatic. Laboratory diagnosis. Microfilaria can be found in peripheral blood as Vibrio bronchiophyti. Peripheral blood can be demonstrated by blood either 2 types. One is mount weight and another one is stained preparation. Thank you.